This is Dr. Dennis Nikitow, and on this series of Chiropractic Approach to, I would like to talk a little bit to you about some of the cranial bones and cranial movement that occurs here in the skull, because a lot of people don't realize that the bones in the skull actually move. And if it's really important that you're seeing a chiropractor that does cranial adjusting, and here's why. A lot of times the bones in the skull they're going to affect the bones in the neck because of the neurology. There's a lining on the inside of the skull that's very neurological, okay, and it will fire or misfire impulses throughout the whole body. I mean, doctors like Dr. Upledger, who is an osteopath, excuse me, has done extensive work on craniopathy. And the bones in the skull have been shown to actually flex on one another on joints called sutures. So basically what happens is if the bones are out of alignment or they're displaced in the skull and flexed the wrong way, it can cause an endless problem with headaches. Even if a patient goes to a chiropractor, and we have great success, 80% of headaches are corrected by chiropractors because of the bones being out of alignment or subluxated in the neck, compressing on the brainstem and the nerves that come over the top of the head. However, if a cranial bone is out of alignment, a chiropractor will keep adjusting and adjusting, and those headaches will never disappear. So I want to go through some of the cranial bones and explain some of these things to you so it makes sense. Because oftentimes, like I say, we have all these different plates that actually make up the skull, and they can flex and bend. So the first thing I want to talk about is I want to talk about what we see very commonly, the temporal bone. Now the temporal bone is a bone that sits right over here on the side of our head. And then we have a sphenoid bone, which is actually what we call the floor of the brain. Well, these two bones are one of the top ones that are responsible for headaches. In fact, when we see patients with temporal bulges or misalignments here, what happens is patients can get problems with headaches, and this is oftentimes we see patients getting this type of cranial fault or subluxation or dysfunction as a result of chemical problems. So let's say you're sensitive or intolerant to something. You eat a food that you're sensitive to, basically, or there's a toxicity in the food. Or there's a problem with your colon. A lot of times what will happen, all of a sudden you'll get this pain right over your head, and it'll wave over your eye, it'll go over your head, over your jaw, and into your neck, and then it'll start to affect your upper back. Well, the chiropractor will go and adjust it, but it'll keep coming back, and you'll say, it's right here, it's right here. Well, what happens is if you have an intolerance to a food or a chemical, what will happen is immediately you'll get a temporal bulge on one side or the other. If you have problems with constipation, usually you can have cranial faults on both of these, so they have to be adjusted. Now, when you go to adjust this area, like Luke has a problem right here, and he has a problem with the sphenoid. Now, the sphenoid can cause a lot of problems from dizziness. It's the leading cause of migraine headaches. We see patients with vision problems, all sorts of different things. So when we check the sphenoid over here, what we'll do is we're going to adjust the temporal, and then the sphenoid is just ahead of it. So when we have an adjustment done here, we'll have most of these cranial bones are done in a breathing method. Okay, so Luke, take a breath in. And I'm pushing together. Breathe out, breathe in, breathe out, breathe in, breathe out. One more time, and then out. Now, usually you can make that adjustment, and when you feel the bone, doctors, if you're watching this, you'll actually feel a bulge occurring on the right side. What you're actually doing is squeezing that together, and it'll rebound and come back to normal. Now, usually when you have this temporal bone out of alignment, there's a bone that's on the top of the skull called the parietal bone. It's this big bone that sits right up in here. Usually that one will drop downward. So what we'll do is feel that suture here and feel if that's off. We can also do muscle testing to test it, like applied kinesiology. We'll test the muscle. We'll kind of push on this bone. If the muscle kind of triggers weak, it tells us there's a problem. So I want you to breathe in real deep and breathe out. And I'm lifting the bone as he's breathing out. Whereas this one, as he was breathing in, I was squeezing. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Okay, so now those are corrected. Usually this bone and this bone will react to one another, so you have to kind of check them to see if they're both off. The sphenoid feels much better. You can also adjust the sphenoid by just pressing in on it while the patient's breathing in. Another way to do that is using an adjusting tool. Now here's an adjusting tool, which we call an activator. Okay, this adjusting instrument, there's a lot of different kinds, but basically I'll set the tension kind of low, maybe one turn, and then I'll come in and I'll actually adjust this. And what this will do is it'll actually trigger fire onto the nerves and cause those nerves to deactivate that their oversensitization and allow this bone to just kind of fall into place, okay? The next one I want to address is the frontal bone. The frontal bone is this one that sits right over here. Now, a lot of times patients can have problems with thinking. They can have problems with cognition. They can have problems, like we'll see patients that have problems with the temporals and frontals together. If you want to see if you have a frontal, one thing to do, you can do as a patient, is look in the mirror and see if one of your eyes is a little narrower than the other. If you have a problem with the eye narrower than the other, if you have vision problems, different things like this, you can have some problems, or thinking problems, like when you go into a room and you can't remember why you went in there, you can have the doctor check the frontal. Another important one here is the sinuses. The sinuses over here are affected by the frontal. So if the frontal is too far down this way or this way, we can simply adjust them this way when the patient breathes. Okay, and we also do some, open your mouth, we'll also do some adjusting in the mouth where we'll actually do pressure on points of the palate. Now the palate is really important as well, because the palate's kind of like a magic spot, okay? The palate in here is basically a flat area here. Now what we see is when the palate is off, okay, you'll see it like a patient will have a lot of sinus congestion, like on one side. If the palate is off, we'll go in, or if a patient has a cold, we'll actually stick our finger in here and actually massage the palate. So what I would be doing is massaging Luke's palate here from the center ridge over to one side, whichever side is tight, okay? And what that does is it actually immediately will free the sinuses and they'll start to drain. It's absolutely amazing, okay? And if patients have a big ridge in their center palate, they're destined to usually have problems with the sinuses, okay? So that's a very important spot too of checking, say, if they have sinuses. The other one here that we would look at for sinus issues is the maxillaries right here. So a lot of times patients will feel a lot of pressure here. So what we'll do is we'll come in and we'll actually take the activator and we'll adjust on that specific area, and all of a sudden, right underneath our fingers, you'll see that maxillary bone just all of a sudden set. When that happens, the patient will get up and walk away, and their sinuses will be clear. It's absolutely amazing. The next thing we look at is we look at the jaw joint, or TMJ. Now, Luke, open your mouth. Luke's he's not deviating, but we would look for deviation. Like, let's say, Luke, move your jaw this way. A lot of times if a patient was opening their mouth, they would deviate to one side. Well, what we would do then is have the patient open their mouth real wide. We come in right here where the jaw comes up into its socket, and we'd make a little adjustment straight down this way, and that would center the jaw. Another way to do that, the jaws can be too far closed or open, meaning that this jaw joint could be too overactively closed, pulling this way. So we would turn the muscle activity down by doing an adjustment here to turn the nerve down to this muscle. If it was too far open on this side, we'd go into the mouth and press on the back of it, and we'd actually be doing an adjustment inside the mouth where we're actually rubbing on that particular muscle to relax it and loosen it. And then when we have the patient open and close, they would be able to glide more properly. Now the other thing I want to talk about is the sutures. Now the sutures are the joints over here. Now when we see the suture here on the very top called the sagittal suture kind of jammed, patients can get headaches right at the top of their head. They can have a lot of problems with what's called bipolar or apolar issues, where they don't think properly. They have a lot of issues where they switch up numbers. They have a condition we call switching, and that's a lot of times caused from this mechanism over here where it's compressed. Now remember, there's an inside lining of that cranium, which is causing nerves to misfire. That's why people will all of a sudden have these triggering mechanisms where they don't think properly. So if this particular area where the suture is jammed, I will go ahead and I will open it up by just spreading apart while the patient, most of the time, takes a deep breath in and I pull it apart. Okay, or if it's too far open where I can feel that it's open, I'll kind of squeeze them together in that specific area there. Okay, so TMJ, jaw, we have the frontal bone, which can affect the sinuses, it can affect thought. We have the maxillaries over here, again, that can be adjusted. The palate, which is extremely important. Some doctors actually think that the palate has a embryologically originated reflex areas that can affect virtually anything. In other words, we see a lot of times, I have a patient that has Parkinson's disease, and we do a lot of work with his palate, and what it does is it actually stimulates neurological activity, so he's actually doing a lot better. His forward head posture like this, from stimulating his palate, has come back and has stayed pretty consistent as a result of us working on the palate, along with the spine, because we'll always adjust the spine, those areas here. I want to move down underneath in here into the throat. This is a really important area. There's a little hook bone over here. It's about like this. It's a little ring. It's called the hyoid. Now, one of the most powerful things that you could do for laryngitis, besides adjusting the spine here at C5 and 6, is checking that hyoid bone. You see the larynx is in here, and the larynx could shift back and forth because the muscle can then pull it over. So what I'll typically do is I'll do a muscle test, like Luke, hold your arm tight. Okay, I'm just testing, he's pretty strong, I'm only using a couple fingers, and I'm going to challenge, which I push it over, and he weakens. Challenge here. Now I know Luke, his larynx tends to go in this direction. What a patient will feel is a lot of times they'll feel like there's a lump in their throat, or they'll feel like there's a pressure here, but more importantly, laryngitis. Now studies have shown that a chiropractic adjustment, when we adjust this area, the hyoid or the larynx, and we adjust the neck at C5 and 6, in those areas that supply the nerves in there, okay, C3 through 6, that laryngitis will go away, 100% will go away in 24 hours. Okay, and the study that you're seeing here shows that when the spine is adjusted and the areas are adjusted in here, we get tremendous success with laryngitis. You know, we've had lots of patients that have had problems with laryngitis for weeks on end, and all of a sudden one adjustment, it goes away within 24 hours. So what we do here, there's a couple ways you can adjust in this area. Now we'll usually take an activator here, and we'll go ahead and adjust his larynx this way, like this. Okay, and then we'll check his hyoid bone, which is just above that. Hold your arm, and we'll feel that little bone and move it. Okay, so his hyoid bone seems to be okay, but the larynx was shoved over to the side, okay? So we made an adjustment there. Another way you can do this is you can just move your, put your thumb over here, doctors, and then trigger those specific areas with a reflex snap onto the thumb, which will trigger the nerve to relax, and it'll cause the larynx to move into position. It's really important you identify this when patients have these types of issues, because they can be ongoing, okay? So those are some of the things that we work with. There's other sutures here that can close down, called the Zygomatic sutures. They can affect, like, do you ever notice when your eye flutters and fasciculates? It's called fasciculation. It just has that annoying little flutter. That could be because this bone's out of alignment. A lot of times people get hit in the face with a ball, stuff like that. They can have ongoing headaches because the suture's jammed. So we'll do adjustments to open this up on a breathing of respiration, either inspiration or expiration, depending on what the patient shows, okay? This area up here called the glabella could jam also, and this is another one that we typically see with sinus issues. So what we'll do is we'll make adjustments into here. Flip over in your stomach, Luke. The last thing I want to show you is the areas in the base of the skull. When we look at the base of the skull, if a patient's got a lot of visual problems or they have headaches back here, there's some sutures here back here called the lambdoidal sutures. And then we have a little occipital bone here that can shift around. Now if this is shifted around, it can cause a lot of pressure here, which can affect headaches, it can affect visual problems. So we check to see if these sutures are open or closed, and then we close them or open them with a phase of respiration. We adjust this bone here, and then we can also make adjustments into the base of the skull. So the cranium has a lot to do with a lot of different things. I mean, it can affect the sinuses, it can affect mood, it can affect chemicals in the brain, it can affect upledger, and a number of different researchers have found that kids with dyslexia, ADHD, oftentimes have problems in the cranium. And if the cranium and the jaw is not addressed, those kids can still have ongoing problems with ADHD, because what's happening is it's the nerve that's misfiring. And if the nervous system's misfiring and there's a switching of messages, you're never going to allow those messages to come into balance. Now, in our clinic, we've had virtually every child with ADHD we've helped. So that means no Ritalin, no Adderall, no any of those things, because it's basically a neurological activity which we've been able to help by adjusting up here. We give some different patterning exercise, which we'll go through on another segment of the chiropractic approach to. But make sure that your chiropractor is privy to cranial adjusting, because it can make a huge difference in your overall health and not just the symptoms that you have. And chiropractors, if you're wanting to learn more about cranial adjusting, you could check out some of the courses that I offer. So again, I want to thank you for joining me today, and I hope you gained some insight on the chiropractic approach too.